Hi, this is Dr. Neil Schwartz. Today I'd like to talk about the concept of, quote, unconsciousness and how Western medicine accidentally propagates and furthers unconsciousness in the human psyche. I'd like to use an extreme example to make the point. You all have heard of gastric bypass surgery, and some of you are familiar exactly how it works and how it actually helps someone get down from an extreme obese situation down to a more regular body habitus. Let's talk today about how the gastric bypass surgery works. And once you realize how it works, you realize that Western medicine is accidentally enabling unconsciousness. Let's talk about it. How does gastric bypass surgery work? Gastric bypass surgery simply closes down the size of the stomach and allows it to be stretched with a smaller amount of food. And when that stomach stretches with a smaller amount of food, the brain is signaled to be full. And thus, you're doing a surgery on your stomach to initiate a change in your brain. Essentially, it's like an indirect lobotomy. You could just do the surgery on the brain itself and have the same effect. You're doing a gastric bypass surgery to trigger off satiation in the brain. When you think about gastric bypass surgery like this, you realize gastric bypass surgery is really a psychiatric surgery. You're cutting open someone's body and shrinking down an organ to change an emotional and instinctual state of mind from being hungry to being satisfied. That's what a gastric bypass surgery does. It simply tells the brain that the patient is full with a smaller amount of food. Think about that. In other words, the gastric bypass surgery is an indirect lobotomy. You might as well just do a direct lobotomy and cut out the hunger center of someone's brain. You see that the doctors who came up with gastric bypass surgery are brilliant in their band-aiding effect, but they are avoiding at all cost the concept of transformation. It's the opposite of the show The Biggest Loser, where they're looking to transform someone's life. A gastric bypass surgery is essentially saying, live how you are living, live out of balance, and we will cut you up so that you're not hungry. And the interesting part is that it works. It saves people's lives who are unconscious and, unfortunately, keeps them unconscious. Instead of having to pay attention to what they're eating and pay attention to how they're moving, instead, their hunger is curbed by a physical change in their body. It's interesting to say the least. What's more interesting about it is how you can view Western medicine in its accidental enabling of imbalance. For example, a patient who's 30 pounds overweight and a little bit overworked and stressed out, not really taking care of themselves, comes into a doctor's office and his blood pressure is high. The doctor will say, diet, exercise, and take these blood pressure pills, and that will be the entire conversation. What's going to happen when that person gets home, instead of transforming their life and taking care of themselves, they're just going to take the blood pressure pills. And then every month after that, they're going to increase their dose and increase the amount of blood pressure pills they take for the rest of their life. That's why people say when you get on blood pressure pills, you'll be on them for the rest of your life. Essentially what they're saying is, we don't think you're internally or mentally powerful enough to make a full body and life transformation. And since we don't have faith that you actually can make change or actually make a transformation, here are your pills for life. Even though the doctor says diet and exercise, there's never really a plan set forth. There's never really an optimistic thought that this person is going to completely transform their life. And in that lack of transformation, Western medicine accidentally enables imbalance. You can do this example with almost any chronic condition that is treated with medications. Accutane, for example. If you want a quick fix at high risk, convince your doctor to get you on Accutane. That might be the solution for you. It will keep you unconscious and keep you unable to take care of your skin. It's the concept of enabling. If you give someone a pill instead of transform them, they end up without skills. And then when the pill stops working or there's a resistance is developed, they end up trapped and helpless, like a helpless baby, with no skills or weaponry to take care of their life. So the concepts of this video that we'll touch upon again in the future are the concepts of, quote, unconsciousness, enabling, and transformation. They're all related. If you're unconscious, it means you lack a certain awareness or skill in a certain part of your life, maybe a certain part of your health. And if you get enabled by a practitioner and you don't learn these skills, you will forever remain unconscious. Transformation is entirely different. In a transformative practice, we don't enable clients. Instead, we help them find their blind spots. We help them find the skills that they do not have, and we give them weaponry that they can safely use for a lifetime without having to be worried about side effects. Transformation is about acquiring mastery in an area that you are deficient. That's very different than gastric bypass, Accutane, or blood pressure pills. All three of those solutions enable patients to not find mastery. Instead, to continue on with what they're doing despite the creation of imbalance. The concepts are worth revisiting, and we'll talk about unconsciousness, enabling, and transformation many times in future videos. I'll talk to you guys soon. Take care.